But did you do it on a mannequin with like the most beautiful urethra and labia you've ever
Literally
seen?
smiling and winking at me.
Exactly.
I know. Which is very different than it is in the real world. Sometimes you be hunting that thing and can never find it.
You be hunting for that thing.
Grab a coffee.
Take a breath.
You've just clocked into the ER edit.
I'm Caitlin.
I'm Carly.
You are now clocked in.
Hi, welcome to episode 4.
We're on 4. I can hardly believe it.
This is so fun.
But also we've been having the best time doing this.
Gosh.
But I still feel a little nervous at times.
Every time.
Okay.
Every time we start, I feel
make sure it wasn't just me. We are literally running on crunch time. Ryan came home just for one day, right? He's like here for like 1 24-hour.
He got off this morning and he goes back tomorrow morning.
For one more shift.
For another 24.
But then you go to work.
And then I go back. I have to leave like within 30 minutes of him getting home the next day.
You guys are 2 ships in the night.
We're just passing each other.
I know. And then Nick went out of town tonight. So we're single momming it. Look at you.
Look at us just roughing it on the streets. Roughing it out here.
But also my grandma's coming over tonight to spend the night with me. So we do things a little different. Carly likes to stay home alone. I'm afraid of the dark.
I do not like to stay home alone, but I don't. That's just the name of the game.
I know. Well, we're in for a good one today.
Yes, we're really excited about this one. This has been a top requested
since before a podcast was even in the sites. You guys have been asking us this same simple question whenever we record together and also on like our separate channels. Often is things we wish we knew as new grads.
Yep.
It's a big one.
It's a big one.
I think I get asked it almost daily.
Yeah, I didn't realize. I think we have a lot of like nursing students, new grad nurses. And I get it. I think sometimes you forget when you look back on all the things that would have been like helpful to know.
Yeah.
So just in our content online, I think people are like, oh, thanks for letting me know that, or, you know, whatever. And so they're like, can you do an episode where you guys talk about things that you wish you would have known? And I'm like, this is a great idea.
Yes, especially because I don't know if it was the same as you, but I went to nursing school having no idea what I was about to get into.
Oh, yeah.
But then also, it's the same thing when you graduate nursing school. You are not prepared for what goes in.
You are not prepared. That is accurate.
Yes. So I remember
they do the best they can. And I know I do think that they're really good. Well, I don't know. I went to a BSN program.
I did too.
And I think that I got a great education, but I do not feel that I was prepared with clinical skills.
Literally nothing.
Like
except
at all.
for how to put in a Foley, because that was like literally ingrained in my head, and you essentially would fail out of nursing school if your sterile technique was wrong.
But did you do it on a mannequin with like the most beautiful urethra and labia you've ever seen?
Literally smiling and winking at me.
Exactly.
I know. Which is very different than it is in the real world. Sometimes you be hunting that thing and can never find it.
You be hunting for that thing.
But there are things that I wish, like looking back on it now. Okay, you've been a nurse for what, 14 years?
Yeah.
I'm going on 13. And looking back now, if I had the same kind of social media that I could look at now to prepare for nursing school, I went in blind as a bat.
Girl. I had no healthcare experience. No. I worked at Starbucks. That was like my most, like the best experience I had because of like customer
I worked at Starbucks
service.
too. It was my very first
in
job.
nursing school?
Oh, no. Before, in high school.
I loved working there. Honestly, I would
go back now, actually.
If they would pay me nursing wages, I would work there.
Sign me up. And their benefits were great.
They were. And free coffee. Yes, please.
Hell yeah.
I did not have healthcare experience. When I was, I think, like a year into my program, I was able to apply as a nurse tech, which I was scheduled on the schedule like a CNA.
Yes.
The difference was my badge said nurse tech. And what that meant is I think if I had done clinical skills and been signed off, like blood sugar checks, I was allowed to do them at work, which typically that was not.
Because they signed you off.
Right.
Yeah.
The CNAs could not do that.
Right.
So I was basically a CNA, but with
a little glory in there, a little glorified moment.
A glorified moment. I definitely question though, when I started working as a nurse tech, I'm like, what?
So I did something similar in nursing school. I worked as a nursing assistant, but that was because I didn't have the certified behind it. So similar to you.
Yeah.
But I worked on an oncology unit, and I thought to myself,
heavy.
Nope.
Yeah.
This is not for me. But I was already, Nick and I had already moved to the Midwest. Like we were in the thick of it. So there wasn't any way I was going to be like,
totally.
just kidding, I'm out.
Well, people ask me too. They're like, what got you through nursing school? And I'm like, the student debt.
Oh, yeah.
If I quit and I didn't have a career to pay this off, that was my driving motivation.
So you had student debt?
Oh, a lot of it.
Same.
So
I think that that's a big misconception too. So there are two. So, I mean, we can break this down.
Let's
from
just jump
in. Beginning. Associates and bachelors. This is a huge question we get all the time is Carly and I both have our BSNs. Are they necessary? I have my opinion on it. Do you feel like nurses?
Do I personally?
Yeah.
No.
No, same.
Absolutely not.
Also the debt.
The debt's crazy. I was also 18.
Yeah.
I graduated high school and I was like, I'm going to go to nursing school. And I wanted the whole college experience.
Yes.
I jumped right into a private university. That's a whole nother story.
I know.
I had to learn very quickly how to like study and she didn't do well. And so in order to keep all my grants and my scholarships, yada, yada, yada.
Well, when kids start college, we're 18. We're here for a good time.
Yeah.
Not to be in the
And
books.
I went from Washington State, which is gray and rainy 99% of the time, to Southern California.
Yeah, we were
so
ready
when
to
my
go
friends were like,
outside.
do you want to skip class and go to Newport Beach for the day? Yeah, let me grab my suit.
I sure do. And we were failing all of our classes. Yeah. I had those moments too. I did go to a JC before this to do all of my prereqs, but let me just tell you about the grades I had at a JC straight out of high school. Not great. They were not good. So that is something to take into consideration. If you are wanting to have a good time straight out of high school, which we are totally proponents of and think you should, enjoy your time.
Yeah.
Don't do nursing school then right away.
Right.
If that is something that you are interested in doing, go have a good time and come back into the nursing student life when you're ready to literally have your head in a book at all times.
Yeah, I think that going to get my bachelor's from a private university right out of high school was not
ideal. It was not a good idea.
It was not the most cost-effective way to go about it.
Yeah.
But I was also young. I was trying to figure this out on my own, stumbling along my way.
Yeah.
I mean, I think by the end, I knew the financial advice, like office ladies, like we were like this.
Oh, you were invited over for dinner.
I mean, how many times was I in there in tears? Like,
oh, yeah.
How much, what more money can I take out? Which is like a whole scam in and of itself that I was allowed to be taking out these private loans with astronomical interest rates.
That's you
crazy.
Don't ever see. Like to us, they're just like literally numbers on a paper at 18 years old. And you're like, sure, I'll sign that. No problem. And
can I go to class next month? Like, I need it.
But then they're like, oh, don't worry about it. You won't see it until you graduate. It's no big deal. You'll be having a great job.
There's a 9-month grace period.
All of this stuff. And it's all bullshit.
And then that shit hits you. And
you're like, holy.
Excuse me?
Yeah.
So back to the original question. No, I don't think it's necessary. I think that I'm glad I got it. I'm glad I would not change my route, which is kind of feels contradictory to say, but I'm very happy with the way I did it. I was not informed of all the other options.
Right.
Also in the workforce, the amount of people that have like an ADN or an associate's degree, I would say probably is higher than people with bachelors. Yeah. And there's literally no difference.
No, we make the same amount of pay. So that's another question that people always ask is typically at the hospitals, you are paid based on years. So
years of experience.
Years of experience. They could be on a grade level, which goes into your years of experience. It has nothing to do with your degree. And to be quite honest with you, as long as you have passed the NCLEX and can show proof of having an active nursing license, they do not care where you went to school or what degree you have.
Yeah.
So that is a big one. I would not stress over getting a bachelor's degree if an associate's is within your wheelhouse and more doable. It's 100% the same.
Well, and there are a ton of bridge programs out there. Yeah. So if having your bachelor is important to you, let's say, or you want to go into management or an admin and you need that.
Yes.
I would say junior colleges, associate programs, work as an RN. A lot of healthcare systems, after you've worked there for like a year, have education benefits where they'll reimburse your tuition up to a certain amount. So utilize that, do a bridge program and get your bachelor degree on their dollar.
Absolutely.
If that's important to you.
Yeah. And if you do eventually want to go into management, that is something that you will have to look into. You have to have a bachelor's at least to go into management. And then a lot of the time, if you want to move higher up than that, it's a master's. So that's kind of avenue of it.
Mm-hmm.
The application process, somebody asked me about this. It is very overwhelming. Do you remember that for nursing school?
Oh, for nursing school,
Mm-hmm.
yes. I try to block that out of my memory, but...
Did you have to take a TEAS test or a HESI?
No.
Neither one?
Not that I can remember, no.
So that's a question I get too sometimes. Maybe it's a Midwest thing, but I had to take a TEAS exam that basically put me in a pool of applicants. Like, it was an intro exam, but you had to pass with an 82 or an 83 to even apply for nursing school.
To be considered.
Yeah. So those are there too. There are things like that are out there too.
Well, and a lot of programs have very different application, like there's lottery systems.
Yeah.
The nursing school that I went to was you applied. Obviously, your grades mattered. You had to have like a minimum GPA,
Oh, yeah.
but you had to write an essay. You had to have letters of recommendation from people in your life. I think like my high school biology teacher wrote one. And they literally have a team that sorts through and then they hand select people, where I've heard of programs where it's like a point system.
Yeah.
Or you have to meet their qualifications and then it's just lottery, like who gets drawn.
So
which is crazy.
Yeah. A lot of California is lottery unless you go private.
Mm-hmm.
And then I think their working system is a little bit different, which is exactly why Nick and I moved away, was because I had applied twice for the lottery system here. And,
You did? I didn't know that.
And didn't get picked. And so Nick was actually the one that was like, let's look at other options if you just want to get it done. So that's why I ended up moving to the Midwest. And then my BSN program was only 16 months because I did the accelerated version. And so it was like, let's just wham, bam, thank
My
you,
BSN was
ma'am.
3 years.
Hell fucking no.
Yeah.
No. So as you can see from this, there are so many different avenues that you can go. It's crazy. But there are also like other things that I wish I knew, and I'm sure you wish you knew before we went to nursing school.
Once you enter the workforce, that's where you learn.
It's crazy.
It's crazy. I feel like I didn't become a nurse until 2 years after actually being a nurse.
Oh, 100%.
If that makes sense.
Oh, yes. All of that makes sense.
And I get nursing school. Like they have to teach you physiology. Like you have to go into situations with concepts of how things work.
Yes.
And I know they have to, to their best ability, they have to teach you critical thinking skills but it's also like, you need so much more experience to develop those skills.
So I also don't think that at 21, 22, when all of these, even younger, are entering the nursing workforce, are not prepared for what you're about to face on, like head on.
Mm-hmm.
And I mean, it ties back into what we talked about last week, where it was like, even just aggressive people or people that are on drugs or are in the time in a mental crisis or things like that. I had no idea what I was doing, how to approach them, what to even do. And none of that is taught in school. And it's a huge part of the job.
Well, and it's your first experience probably in your life encountering people in those situations.
Right.
And you're kind of like, deer in headlights.
So you do take psych in nursing school. You take a psych class, but that's essentially learning all of the diagnostics behind it. What is schizophrenia? You know, what is bipolar? What medications are
The medications were huge.
Yes. So that was like the bulk of the exam, is what meds do you give? What are their, interactions? What are the side effects? Things like that.
Did you have a psych clinical rotation?
I did. And it was horrific.
Yeah.
Was yours too? Mine was peds.
Oh, peds?
Mm-hmm.
Oh, that's hard.
I'm like, you're not even going to show me an adult? I never saw an adult psych patient.
Oh, I did.
And how was it?
It was, as somebody who loves true crime, it was very interesting. It was scary. I was at I
was going to say, was it a lockdown psych unit?
It was a lockdown psych unit. It was a state hospital. And I was in an all men's intake ward who had not gone to trial yet.
Oh my gosh. Okay. The best thing about this though, is were you able to look at their charts?
Yes, I was. However, the nurses station was like, it's like a fishbowl, like in the center of the unit with like, you could see all out of it.
I don't know that
And they were and I was warned about this. Like they're very, they like to see who's looking in their charts.
The patients do?
Yeah. And so I would sit in there and I would read charts and they would be like circling.
What?
And I was allowed to go out and mingle.
No.
And there was one incident where I was sitting on a couch talking to a patient who it was so hard for me in my mind because it was just like you and I talking. I'm like, this is crazy that this person's in here because they feel just like I would be talking to them.
Had you already known what they did?
No.
Okay.
So I'm talking to them, and all of a sudden, a few other men start kind of like circling around, like coming in to sit. And you know that feeling we talked about where like the hair stands up,
already is
something
right
feels wrong, and like it almost catches your stomach.
Yeah.
I just knew in that moment I needed to get up and leave.
Yep.
I immediately walked in, I shut the door behind me, and it's locked doors, so they can't get in. And I sat down, and I was just almost like my heart was racing. And I went and I tried to like subtly grab the binder or the chart of the one I was talking to, and I was reading what, their case was and everything.
Worst you've ever heard?
One of the worst things I've ever heard.
In prison for life. Should be.
I don't know what happened. I did not follow like what happened with their trial and everything like that. I'm going to go with yeah.
And he was like, essentially, like,
he was younger than me.
What?
Mm-hmm. And I was 22, 21.
See, and that's the scary part of that. So the kids were kind of similar in the sense that, but it was more reading the charts and what you found out was going on at home.
Mm-hmm. Oh, yeah.
And that was the thing with the kids. So they all had true psych components to them.
Sure.
But I think there was also a level of they got removed for a reason.
Mm-hmm.
But this is the crazy thing is this is your one chance. This is your one time in your entire like nursing school career that you get to see this head on. And truly it's not enough. Because then you go into the workforce and you are literally faced with it every single day.
It sounds like both of us were exposed to some very like intense, like niche experiences.
Yes.
But when you work in the ER, you're kind of faced with some level of mental health every day on the spectrum, of what it is. And it's not always violent. It's not always like massive crimes, but just even knowing how to approach, have conversation.
I had no idea what to do. And honestly, I started out as a new grad in the ER and people would come in and you can hear them sometimes down the bowling alley, we call it. Like it is a long pathway that stretches from the ambulance bay, but that's also where the police park to bring patients in or things like that. And you can just hear someone walking in, popping off. And it used to really scare me because I was like, what am I supposed to do in this? That sounds scary.
Yeah.
And they don't prepare you for that as these like young little kids. What they do want you to see is like how beautiful labor and delivery is. And let's go have a shadow day in the NICU. And I'm like, no. Like we need to see the real nitty gritty.
I'll never forget ever being in clinical when I was a nursing student and having this one instructor who was like all about like she was amazing, but in my opinion, like not realistic in the real workforce. I remember one time a patient had like dysphagia, which it means they have issues swallowing. Mm-hmm. So a lot of times they'll have orders for like crushing their pills or you have to thicken their fluid or liquids when they're drinking. And I remember it was on med surg and she was massaging their throat
to have them swallow
while they were swallowing to help like assist and like this holistic hands-on. And it was amazing. I was like, wow, she's such a good caretaker. Like in the real world, when you have 6 patients or you're running around,
we're not massaging a throat to help them get their pills down.
Yeah. And I think I had a very, very unrealistic idea of what I was about to enter in the workforce.
Yeah, I think nursing school does not prepare you for the reality that nursing is. It prepares you for textbook. It prepares you for the NCLEX.
And you think you're going to go out there and you think you're going to be a real life hero. And that's how I felt.
I did too. And I was ready to take on the world with my stethoscope and brand new scrubs. But I wore it every day. I wore that stethoscope every day. Ask me the last time I wore it.
Well, you're in there long enough and you realize somebody can grab you around the throat with that thing.
That thing is never around my neck.
That's a weapon.
It lives in my locker and I will go get it if I put in an NG tube.
They also have disposable ones you can grab. Well, a doctor will have one you can borrow.
All the time. So if you need to listen to lung sounds or things like that, they're all available there for you. But a stethoscope is literally the number one piece of equipment that I feel like can be used against you.
And to have it around your throat, they're just going to choke you.
Yes.
So I thought it'd be fun to both write down or come up with like 3 different things that we both wish we would have known before becoming nurses. And we haven't shared them with each other. So I think we should share with each other and then explain why.
Okay. Who wants to go first?
I'll go first. Something that I wish I would have known is how to actually get the information needed to call a doctor when I need to call them.
Yes.
Let me explain.
We've all been yelled at.
We all know what an SBAR is. If you're a nurse, an SBAR is like an acronym for situation, background, assessment, and recommendation. And that's kind of like they teach you this format of kind of the information you should have when you're calling the doctor.
Or another nurse to give a report.
Sure.
Yeah.
It's good. It's good. But in reality, when you're calling a physician at 2 a.m. or even for that matter in the middle of the day, a busy doctor, if you're calling and you're asking for something, I wish they would have actually taught us, like, this is what you need to give them. This is what they want to know.
Yeah.
And how to do that succinctly. Because if you sit there and you start trying to give them this long, wordy ass SBAR, they're going to hang up on you.
Well, and then they hate you for the rest of your entire career because they also don't forget, just like we don't. And they will come down eventually and be like, who is Carly?
Right.
They will.
And I know, and I'm not saying don't use the SBAR because there are good components to it. Like when you call, you need to say, hey, this is so-and-so. This is why I'm calling. This is who it's about. Can you order this? Or is there something that you would suggest for this? You know, like there's a way to do it.
I think the big thing to take away from that is that they should teach that there is you explaining to the physician who we're talking about. And that could be first and last name, what room they're in, and maybe what department you're calling from.
Right.
The situation that's going on at this time. So say, for instance, hey, Mr. Johnson is now hypotensive. His current pressure is this. You are giving context to what you're telling them.
Yeah.
And then you're also giving them a solution. Do you want me to bolus another bag of fluids? Would you like to start pressors depending on where they're at? And then waiting for their response. I mean,
100%.
That is literally the baseline of what you do.
And I think the reason I bring this up is because I remember taking so many exams about the SBAR and what the acronym stood for.
Yes.
You know, it was like, what is included when you're calling for orders and you're literally just describing SBAR.
Mm-hmm.
No, I needed real life examples because the first time I had to do it, it was so overwhelming and you're not prepared.
How fast was your heart beating the first time you had to call a doctor? Because mine about thumped right out of my chest.
Oh, I mean,
and they don't teach you too that some doctors are jackasses. They really are. Some nurses are too. This is not a one-side thing, but some doctors truly, I believe, get off in making you feel incompetent.
Right. And I was just going to say that the first time I got screamed at or
you never forget
belittled or cursed at.
Oh, yeah.
And it's not the norm, but it happens. And when you already are nervous and you're already like not confident in those skills because you are kind of learning on the fly of what you actually need to say and ask for, to then be treated that way makes you feel crushed. I remember being like, I don't want to ever have to do this again, but you have to. You literally have to.
You do. And nursing school does not prepare you for any of that, but it also doesn't prepare you either to give report to like, say, for instance, you are a baby new grad ER nurse and you're having to give report to the ICU for the first time. Oh. Their report and the way that they do things is so different than doing a nurse to nurse report in the ER. And I will never forget my first time giving report to an ICU nurse. And I felt like the dumbest human being on earth because A, they can make you feel that way. But B, it is so vastly different, the information that they want or need or things like that, that it's just like, you literally feel like you have no idea what you're doing.
Right. And this is the whole ER nurse versus ICU nurse.
That's a whole thing.
That's a whole thing. And I think that we love our ICU nurses.
We sure do.
Love them. But have you ever encountered an ICU nurse who has like kind of a superiority complex and you're trying to give a report and nothing you say is up to their standard? That can be really challenging.
Yeah. And there are those, I think, at every hospital. My favorite with the ICU nurses is when they get floated down to the ER and then it's like...
And then they have a little bit of a reality
are like,
check.
We are so thankful for you guys.
Yeah.
And I think that then they go up and tell their friends and then it's better. But there are also ICU nurses that are phenomenal that are like, I already read it. We're fine.
Oh, yeah. Totally.
But they don't teach that.
No. And even to this day, after being a nurse this long, when I call and give report to the ICU or to MedSurg or MedTele, like, the report essentially stays the same, but you also kind of learn like how to give report to ICU versus, med
You also
surg.
know the nurses that are taking a report. Like I see certain nurses' names that I'm giving, like I'm going to have to give report to. And I'm like, got it. I know who this is. I know what to say at this point. But that's been 12 years at this point of doing it.
Yeah.
Something that I wish I knew going into nursing school was that it was more of a mental game than like a true academic challenge. And I say that, it sounds funny as I say that. But yes, nursing school is academically really difficult because it is so busy. There is so many different things you have to do. It's not only, I mean, I don't know how yours was, but like we had 2 or 3 tests every single week. There was also clinicals on top of it. We were learning how to write care plans. It was so time consuming. And I felt like it engulfed like my entire life during that point until I realized, okay, this is all mental. I can take this in and I can process this and still be okay at the end of the day, because I think I was literally losing myself in nursing school there for a little bit until I realized like, you can do this. Like this isn't, and I think a lot of that was people telling me like nursing school is the hardest thing you'll ever do. Yes, it is hard.
Which I do agree with.
Yes, it is hard, but you can do it.
Oh, yeah. People do it all the time.
Right.
But I will say, I don't think I had that clarity you're talking about until I was out of it. I felt like I was drowning all 3 years I was in it.
Well, 3 years is a long motherfucking nursing program.
It was never ending, never ending. It felt like it was so hard. And it's designed in a way, I don't know if this is done intentionally, but to feel like it's set up for you to not succeed.
Oh, 100% felt like that.
And so you're like, it's an uphill battle the whole way through. And certain classes, I've heard different classes at different schools are like meant to be like weeding out classes. I don't know if that's true or not.
I believe
Pathophysiology was one of those for us.
It was pharmacology for me.
Oh my gosh.
About died.
I don't even have memories. Like it was such a wild time, but it is a mental game and there's so much you have to learn, but also there's no way that they can teach you everything you need to know.
No, but I also think it's a matter of you, like if you mentally give up in nursing school, you're going to get kicked out. You will. And so that
you can't keep up.
No. And if you mentally let go of any of that and decide to slip up on any of that, you're done. I mean, and like Carly was saying, they really don't mess around. There is definite weeding out classes. I saw it happen. I'm sure you did too. And it was kind of devastating. Like we had one girl in our specific cohort that like we teamed up with that did not make it through. And it felt like really sad to watch one of your own. You become
so close with
the
people in your cohort.
Yeah.
You're with them constantly.
So that was a big one for me too, is it's much more, nursing school to me has been much more of a mental game than an actual nurse has been. But maybe it's because I've been able to figure out how to compartmentalize within the job more than I was in nursing school.
Yeah, that's probably a big part of it, I would guess.
Yeah.
Something else that I wish I would have known or been more comfortable with as a new grad is nobody cares how many questions you ask.
Oh, no.
And I remember being new and everybody says, just ask if you have questions, just ask if you have questions. But you really feel like, A, you don't want to be a burden because everyone's busy. Yep. B, you don't want to be judged because maybe you don't know something that feels like to you in that moment you should know. The reality is nobody cares.
Nobody cares.
And they want you to ask questions.
And even some of the questions you might be asking the nurse, that nurse might not know.
Yes.
You might actually have to go and investigate together.
Even the most crotchety nurses on the unit, because we all know that there's those crotchety old nurses.
Bless them.
That seem very unapproachable. Even those nurses, if you came up to them and you said, hey, quick question, would be happy to teach you or to answer your questions. Even if they don't do it in the most loving, fluffy way.
Which nursing is not going to be loving and fluffing. No. That's another thing. Like you got to get past the fact that you feel like people don't like you. They don't. They do like you. They just don't have any fluff to give. Right?
Yeah. Like, that's a great point because I do remember being like, do people not like me because I'm so sensitive to tone of voice?
Yeah.
And you just have to learn very quickly.
I mean, you got to just suck it up. It's got nothing to do with you. They probably have 6 patients, 2 of which have been screaming at them all day. And then you come up and they're not going to be like, oh my gosh, Carly, welcome to the unit. Let me give you a tour. No, bitch.
That's not always going to be your response.
No,
You
they're
get
going to be
it.
like, okay, if you want to follow me, like we're going into bed too right now. You know, I didn't ever really have like a fluffy nurse that precepted me.
You also started in the ER.
Yeah.
So
There was no fluff.
there was no fluff. I started inpatient, also no fluff, but a little different.
Yes.
I would say.
Yes. But I do agree with you. We have I almost said kids. We have nursing students that come into the ER now and they get to do their like 1 day shadowing in the ER.
Yeah.
And they all look like deer in headlights, as I'm sure I did too.
Yeah.
But I have noticed that a lot of them don't ask any questions. So the last couple of like cohorts that we've had come in, I'm like, you guys have to ask questions. Like if you don't know anything, which we expect you not to, this is your first day in the ER, you're going to see a lot of shit you've never seen before.
And I'm talking like, let me just put this out there. It doesn't have to be like wild in-depth questions.
No.
Like, oh my gosh, what is this procedure that I've never seen? Like, ask me how to turn the monitor on.
I didn't know.
Ask me how to charge
Ask me which
the
way
monitor
the
when I'm about
leads
to
go.
shock somebody.
Yeah.
Like these are things in the moment when you are running a code for the first time and they say charge, clear, and shock.
Where is it? How do I do
Where
it?
is it? How do I push it? Do I need to change the joules manually? Like literally the most basic things.
I don't even expect you to know what size gauge an IV is. Is it pink, green, blue? I don't expect you to know any of
That's
those.
exactly what I'm saying when I say like, don't feel embarrassed because you think people feel like you should know this. Nobody feels like you should know this.
No,
and
I
everybody
still-
remembers being like,
Yes.
shit, I don't know how to do that.
Yeah. And in the moment, I need somebody to show me real quick.
Yeah.
I will not, like, this was maybe a year and a half ago. I had not been a part of pacing somebody for a long time. I mean, like, it had been a long time.
Or like setting up the pacer.
Yeah.
Yeah.
And I was like, assistance needed in room 115.
Current day, if I have to set up an art line or set up an epidural, have I done it? Yes. Have I managed them?
Yeah.
100%.
Yeah.
Do I set them up frequently enough to feel confident? No. So do you know what I do every time I have to do it?
Google.
Hey, can somebody come help me? Or a nurse who did it the other day. Hey, can you come help me? I know you just did one of these.
Yeah.
I've been a nurse for 14 years. No shame in my game.
No, and a lot of
I'm
the
not
stuff that
hooking
you're
an
gonna
epidural
be-
up when I don't know if I did this correctly.
And that's, I think, the biggest point is we would much rather you ask questions than to attempt to do it on your own and have it become an issue
Every
or
time.
some sort of a sentinel event. And all of us have been there. I mean, look, we can share stories for days of things that we don't know how to do. I had a girl come up to me just the other day that needed help setting up an art line, and she had been a nurse for years and years and years. But a lot of the stuff we do is muscle memory. A lot of the stuff we set up is how many times have you done it in the past? If you haven't recently, we probably need a little refresher.
Yeah.
And there is literally no shame in that.
Absolutely.
Ever.
Yeah.
The last thing that I wish I knew before was how important self-care is to nurses when they get home.
Oh, that's a
Not
great one.
only mentally,
Yeah.
but physically, like all of this stuff. I felt like when
Like how to take care of yourself.
Oh my gosh. As a new grad, I knew nothing and I was so burnt out. Like that was not a good time in life because I had no idea what I was doing and how to take care of myself outside of taking care of everybody else.
Yeah.
And I feel like that becomes a huge part of who you are and who you strive to be outside of the hospital depends on how well you take care of yourself. Otherwise, you literally can't show up for anybody in your family.
Yeah. You'll burn out.
Mm-hmm.
Yeah. And I'll be honest, like in nursing school, I mean, I was fueled by cigarettes and Adderall.
Well, absolutely.
I mean, your girl was barely surviving.
And
So
alcohol.
So then you come out and you're young, you feel invincible, you've got this new job, this career, you're learning all this stuff, right? I think there's like, you work for a while and then you realize I need to take care of myself, not only for myself, but like my mental health is huge.
You will literally watch everything crumble around you if you don't take care of yourself, because then you are giving your worst version of yourself to everybody that truly matters at home. That is the biggest learning lesson that I had. I had no idea at this point in my career how to compartmentalize anything. I hadn't learned that at this point. So not only was I mean, it goes back to the basics. No wonder was I I was eating like shit. I worked night shift for 3 years. And so those AM, PM, 3 a.m. hot, fresh cookies called my name every shift. You better believe it. You drink energy drinks the whole time. You literally are barely getting by. You're not peeing.
The rest you are getting is so bad.
Oh, it's terrible. And you feel hungover every single day without drinking a lick of alcohol. And so, and then on top of it, you're bringing home all of your trauma that you have no idea what to do with.
Yeah.
So it all comes out. And it just got to a point where you truly have to figure out the things that make you happy and make you reset as a human being. And for me, I started going to therapy, and I still dabble in it from time to time when I decide it's necessary. But it's also eating healthy. I mean, it's simple things. It's like eating healthy, meal prepping.
Yeah.
Like, important is sleep and making sure I take time to do the things that I love, whether that's a massage once a month or things like that. You just have to find the things that fill your cup so that you can continue to be truly an upstanding human.
Absolutely. I couldn't agree more. I think that you kind of have to find what brings you peace. And that doesn't always, I mean, that could be something as simple as like reading a book, like something where you just feel
it's for you.
I'm taking care of myself. And on those days, I learned very quickly in the ER where I was feeling so overwhelmed, so just like heightened. On my lunch break, I go outside and getting in fresh air because in the ER, there's no windows.
No, you're in prison.
You need some vitamin D, some sunshine during the day, getting out, breathing real air. Like, it's so little, but it's like that became necessary every time that I was there.
Yeah, we eat lunch outside every single day, rain or shine. It does not matter. We will find a place that we can go just to like breathe a little bit.
Yeah. That's really important. The last one I had written down was, we kind of touched on it already earlier, about like violent patients or combative patients, just learning realistically how to engage with. I know they teach us like de-escalation, which we've already discussed, but I don't know. I just feel like I went in blind. I was young. I felt like I was very, very easy to sniff out. Like, oh, she's easy to kind of manipulate. Naive. She's naive. And I some of this stuff you just have to learn. Like, it's just on the job learning. But I do wish I was better prepared because I felt like I had no idea what I was doing. I remember just thinking, okay, I'm not comfortable. I need to make sure that nothing is between me and the door. Like, I remember having that thought a lot, but that's about it.
There are instances where you truly feel like a sheep being fed to wolves. And it's really, really scary. I mean, it really is. I know that we touched on this a lot last episode and even in the beginning of this one, but I think we're so passionate about it because these little nursing students, I just think if I could go back and recreate a nursing program, this would be like probably a full class.
A ton of emphasis on this. And I don't know if you've ever met anybody who's been like brutally assaulted at work. I met one lady who had every bone in her face broken.
Did she ever go back?
She went back.
What?
I know, which is crazy to think about. Like, the PTSD from that would be wild. But I don't mean to like harp on this, but at any given moment, you could face somebody that has the potential to do this to you in any job, really. If you worked at Starbucks, anybody can walk through those doors. You don't know. But the difference is you are very, very close in personal space with these people, and you're expected to let your guard down to an extent. You're supposed to get up close to them. You're supposed to care for them. It's just like something that really, really needs a lot more focus.
You know what always scares me a little bit is when I'm putting an IV in one of these patients that like, the hackles are kind of going up and I'm like, oh, I just don't know if I love being this close to you. And that is like skin to skin contact. I mean, like, you're getting in, and I'm always afraid they're going to steal the IV from me and stab it in my neck.
Keep your eyes up. Like, you can't keep an eye on them because you have to look at what you're doing. Oh yeah. I've thought about that so many times. Go
straight into my neck at some point. Isn't that horrible?
Oh yeah.
But these are the kinds of things, unfortunately, you have to think about.
You do have to think about it.
Yeah, you got to think of every single possible avenue of how things can go wrong. This goes with aggressive patients. This goes with medication errors. This goes with a patient that's coding. This goes in triage. I mean, literally, this is every single part of nursing, is your brain is consistently going round and round in how something could go wrong and what you need to do to mediate that.
I mean, that's nursing in a nutshell, though, because even if somebody walks in the door and they tell you, oh, I'm having these symptoms and you're getting vitals, you have to also be aware, like, if they start to crump or go south, like, you need to be ready to jump in. Like, you have to constantly be like one step ahead.
Well, and where are you going? Like that's what I'm saying too.
Oh,
like, where are
yeah.
you going? What code rooms do I have open?
Like
Do I have
logistics
this?
of the department.
I mean, it's like the whole thing.
Yeah, I think that's why nurses are so exhausted after coming off work.
Yeah.
And we're literally like,
It's not because we walked.
we need 3 to 5
20,000 steps.
business days to recover.
Right. It's our mental
It's
load.
a mental
too.
load.
Yeah. I mean, that more than anything. If you got the right shoes, we can walk all day. But it's the mental load that you come down to. And it's like you're literally coming off of a high. It feels like. But it's not necessarily a high. It's just that your brain has been literally on.
It's adrenaline.
Yeah.
Your cortisol is through the roof. And you have to give a second to like come down.
I feel like this is why I need more magnesium.
So you know how everybody loves our medication era videos?
I love our medication
Me
era.
too. I found a new one for us to read.
Oh,
Okay.
wait, med errors?
No, it's not med errors, but it's a new
brand
thread.
new-
It's the craziest thing or funniest thing or wildest thing that a doctor has ever written to you.
Oh, I'm ready.
I am so sad for this. So come back for next week's episode where we dive into that and we read those together.
Bye, guys.
Bye.